Hi, I'm Dr. Blackwell, a telemedicine physician in Orlando, Florida, and I'm going to quickly highlight some telemedicine rules and regulations that you need to be aware of. COVID-19 has put telemedicine on the map, and as the use continues to rise, the rules and regulations will continue to evolve and change. Here are 3 important categories that you need to keep in mind when thinking about the rules and regulations of telemedicine. The first is reimbursement. The rules around telemedicine payment are changing. When the COVID-19 crisis hit, the Centers for Medicare and Medicaid Services equalized the reimbursements between an office-based visit and a telehealth visit. And while this is a temporary measure, there is mounting pressure to see these changes made permanent. And for now, the private health insurance has voluntarily followed suit as well. As we get back to normal though, we can probably expect to see some scaling back on the coverage for certain telehealth visits. The best thing you can do is to stay informed about the changes in reimbursements of telemedicine and what that means for your practice. The Center for Connected Health Policy is a great source to use to stay abreast of those changes. The second is privacy. Prior to COVID-19, only HIPAA-compliant software could be used to conduct a telehealth visit. Now you can use a variety of platforms, but remember, you may be putting your patient's health information at risk if you're not using the most secure platform available. Some of the legally approved platforms include things like Zoom Healthcare, Google G Suite, VC, Doxy.me, and UpDocs. It is always safer and more secure for your patient's privacy to use the most secure platform available. And note that as this crisis changes and winds down, we are likely to see some regulatory changes around privacy. The third is licensure. Typically, you have to be located in the state where the patient is located to establish a patient-provider relationship. But once again, COVID-19 is shaking things up. Some states now allow for providers to see patients in states that they are not licensed, but please keep in mind, this is a state-by-state regulation, and there's plenty of states that don't allow it. So make sure to check your regulations before you do this. And as things stabilize, you may be once again required to have a license to see that patient. The Federation of State Medical Boards is a great resource to help you keep track of the latest telehealth regulations and changes that are happening state by state. The pandemic has put telemedicine front and center, and it is here to stay. But remember that the rules are changing and they're continuing to change. So it's up to you to stay on top of them. Keep a close eye on the updates so that you can stay aware of this quickly evolving field and can continue to provide great telemedicine care to your patients.